3-year clinical outcomes of accelerated epithelium of corneal collagen cross-linking for a case of superior keratoconus. The authors have no financial interest regarding this case report. The main objective of our study is to report the long-term outcomes of accelerated epithelium of corneal collagen cross-linking for a rare case of keratoconus with superior cone location. In this corneal topography, we can notice that there is an area of superior ectasia associated with high posterior and anterior elevation. Patients: a 26-year-old male presented with progressive loss of vision in both eyes. The uncorrected visual acuity in the right eye was 0.1 in decimil, corrected to 0.4 by a fraction of -1 diopter sphere minus 3.5 diopter cylinder, while the uncorrected visual acuity in the left eye was 0.01, corrected to 0.3 by a fraction of +2 diopter sphere minus 5.5 diopter cylinder. Slit lamp examination of both eyes revealed a superior corneal protrusion but without associated scarring or vascularization. Both eyes were diagnosed as grade 1 keratoconus with superior cone location by Shavlov-based corneal tomography. Methods: accelerated epithelium of corneal collagen cross-linking was done for each eye separately in 2 consecutive sessions. The patient was followed up for 3 years. In this figure, we will see the follow-up of the case by corneal topography throughout the 3 years. This the first corneal topography which was done before corneal collagen cross-linking. This corneal topography after 1 year, after 2 years, after 3 years. We can notice that there is changes in the corneal curvature in the form of corneal flattening in the superior part of the cornea in the area of the corneal ectasia, with associated improvement in other corneal topographic parameters. Results: visual acuity as regards uncorrected visual acuity and post-corrected visual acuity both are improved, together with improvement of corneal topographic parameters including keratometry, corneal elevations, and pachymetry. In this table, we can see the refractive and topographic improvement in both eyes throughout the 3 years. Here we can notice that uncorrected visual acuity and post-corrected visual acuity improved in both eyes. Also, Kmax show reduction in the right eye and in the left eye. For example, before cross-linking it was 54.9, which improved to 52.24 at the 3rd year, while in the left eye it was 57.76 diopter, which improved to 54.29 diopter. Conclusions: accelerated epithelium of corneal collagen cross-linking stabilized and halted the progression of superior keratoconus after long-term follow-up. Thank you very much, and I hope you enjoy my presentation.